So my name is Kathy Basher, and Lori Vidier is here also, but she just had a hip replacement surgery. So she is lurking in a chair in the corner where we can't get the microphone that far to her, but she's here.
With my feet up.
With her feet up. So we'd like to welcome you to Mental Health Monday. And today the agenda is on knowledge is power, know your mental health rights. Okay, so the speakers are going to go in order, and each will have 10 minutes to do their presentation. So the first speaker will be Susan Kennard, the second is Maria Esposito, and the third will be Katy Welty. And so I'm going to share a little bit about Susan, who I have known for many years. We've done advocacy together, and currently Susan serves as the bureau chief at the Arizona Healthcare Cost Containment System, known as AHCCCS, Department of Healthcare Advocacy and Advancement, Office of Individual and Family Affairs. Who would want to have a title like that? Oh my God, she must be very important. Susan has been involved with the behavioral health community for over a decade, serving as an advocate, manager of family support, human rights liaison, family psychoeducational facilitator, mother of a young man with a serious mental illness, and active volunteer with NAMI, National Alliance of Mental Illness. So Susan, go ahead.
Oh, great. Thanks for that introduction, Kathy. We have known each other for a little while. I've had the privilege of working with Kathy and for Kathy several times over the past, what do you say, like 11 or 12 years. So it's been fun. Okay, hopefully you're able to see it at this point.
There we go.
Kathy asked me to come and talk a little bit about member rights. Oops. So I don't think we can talk about rights of members unless we also are talking about the rights for individuals with a serious mental illness determination. And so what is an SMI? An SMI is just simply a term that we use here in Arizona that designates an adult individual who's in need of additional supports due to the illness really impacting their abilities. And so that's there's certain criteria that people have to meet, and that's really all that determination means. And some people get that confused, and they think if they get an SMI determination, that means they lose their rights, and that is not accurate. You do not lose your rights at all. We still maintain rights. You have all the rights that other citizens have, but in addition, because you're being served in the public behavioral health system, there are some additional rights that are set out by state laws as well as federal laws for individuals who have that SMI determination. A couple of things that includes is assistance from the Office of Human Rights at AHCCCS, and they're there to help explain and protect your rights. And also, there's an SMI grievance process. And so that is special for people with the SMI determination. If they feel like their rights have ever been violated, it's just a special process that you can go through to tell somebody, hey, you need to look at this because I think my rights have been violated. All AHCCCS members have rights. And the one I want to point out and highlight for everybody is voice and choice. So what does that mean? That means that you have a voice and a choice to what services you want to receive. Now, they have to be medically necessary. So somebody has to assess it and say, yes, I think this would be an appropriate service. But as long as you get that medical necessity approved, you have choice of not only what services you get, but where do you get these services? So, whether you're going to receive those from a health home, whether there's a specialty provider you would prefer to receive those from, is there a peer run or a family run organization you're interested in getting those services from? And there's even some services that you could get simultaneously from a couple different providers, going on at the same time. So one of those I want to highlight is peer support. So let's say that you want to get some peer support services and you really like the peer support specialist at the health home. And so you really want to get some services there. But you hear over here at NASCARE, which is a peer run organization, that they have a group that you're really interested in. So you want to go over there and you want to attend those groups. You can do that. It's not like you have to get everything at one location. And so I just want people to be aware that they have voice and choice. And you also have the right to file a complaint. If you are not happy at any time, the way you're being treated, you just don't like the way the services are being provided, please speak up and let somebody know. That's the only way that we can make those changes. And filing an appeal, that's an important one. So when you disagree with a decision made by an agency, let's say that you've requested a service and they deny that service. I tell everybody, if you get a no, don't settle for that no answer, always file that appeal. And as you're going through this process, we have to talk about advocacy skills. So not only knowing your rights, but what do you do with this? When you know your rights and you feel like your rights are being violated, you're not being listened to. So I say, do your research, be prepared, ask for a meeting and come there prepared to discuss what the issues are that you have. And then be polite, even if others aren't. And that's a tough one. So if you feel like you're getting to a point where like, I'm gonna lose my temper here, say, could we take a break? Just take a break, cool off for a couple minutes and come back. I always say, try to leave the emotions out of it. And that is so hard, but stick to the facts. Keep notes, document everything. Who said what, when did the meeting, who attended the meeting, really important to keep all those notes together. Hold others accountable. If somebody says they're going to do something and they don't do it, hold them accountable. Go back to your notes and say on such and such a date, we had a meeting and you said you were going to do this and that hasn't happened. You said you were going to do it by Wednesday and I haven't heard from you and today's Friday. Hold them accountable. Remember, you can take support with you. If you have a meeting and you feel like I could use a friend there, I could use a supporter, you're entitled to bring somebody with you to those meetings. And resources. So the Office of Individual and Family Affairs, we're not just at Access, we're at all the health plans. I'm going to give you a contact list here in just a moment for all the OIFAs. But the Office of Human Rights, here's 3 numbers in Phoenix, in Flagstaff, as well as Tucson. And they can provide technical assistance. They can help if you're going through a grievance process. And they can just help you understand what your rights are if you're an individual that lives with a serious mental illness. And the Arizona Center for Disability Law is always a great place also to get information. And here's the list of all the OIFA administrators, the names, phone numbers, and email addresses. So I'll just leave this up here for a moment. If anybody wants to copy those down.
Thank you, Susan. Obviously, I can see some questions already being developed. So the next speaker will be Maria.
And should I move over a little bit? I'll move over. I'm Rose Berner. I'm here off camera. But anyway, I'll be introducing Maria. I've known Maria for several years, actually. We met quite a few years ago. Maria is a licensed, she's very well qualified. She's a licensed master social worker in Arizona who has been working at Health Choice Arizona since 1991. As a team member of the Health Choice Office of Individual and Family Affairs Department, Maria is the member advocate and veterans liaison. So she wears 2 hats in her job. Her primary responsibilities include ensuring that members and their families have the tools and information they need to achieve optimal health. She also provides educational forums on health choice services. In her role as veterans liaison, as another job she does, Maria collaborates with many veteran programs across the state with a common goal of caring for the physical and behavioral health needs of veterans and their families.
Thank you so much, Rose. I definitely and certainly appreciate you and also everybody who's here, actually. Good morning. And I work at Health Choice Arizona, which we are located, I am in the Flagstaff office. Of course, we're all working remotely at this point. So I am in the Flagstaff office, but I am in the Flagstaff house I'm in. I would like to talk about a lot of it actually parallels or mirrors what Susan just shared, and it is about specifically Health Choice Arizona. And if you would, if you have a complaint or a grievance, or you know, you have a right to file an appeal also. So I did not create a slide deck. I apologize, but I will in the chat when I'm done, I will put the number for our member services department. So if you have a complaint about any of your any concern that you have, if you have a complaint, you can call our member services number. You can also, if you feel that your complaint is not addressed, you can also file a grievance, as Susan explained. Very similar to health plans. However, you know, Access has it at the next level. And you know, when you call in and you want to, you know, file a grievance, we will listen to your concerns about either the services you received or even about us as the health plan. Okay, now with the services you received, some of the things you could file a grievance on would be access to care. Is your treatment, do you feel your treatment is appropriate for your needs? The timeliness of your services, the quality of the care you receive, and staff attitude. That's one, as Susan said, you know, it's really important that we be patient and we be polite, and we hear your concerns. If you feel that someone was rude to you, or any other problem you may have with your healthcare service. So you could file a grievance in two ways. You could file by phone, and that would be calling member services. Again, I will put the number up on the chat. You call member services, you'll be asked about your concern when you call, and you need to tell them the date that your problem or issue happened and any other facts that you have about the issue. You can also file in writing, okay, directly to Health Choice Arizona. You would put it, and I will put that information in the chat also, who you would contact at Health Choice Arizona in Phoenix. You would send it directly to the member grievances department. Your concern is going to be reviewed, and you may be contacted if more information is needed. If you wanted to file in writing, I just said that, and I will put the address in the chat box. Your concern is going to be reviewed. And again, we may contact you if we need more information. Once the review is complete, you will receive a letter telling you the outcome of your filing your grievance. You also have the right to contact Access. That's another option. The Access Medical Management Department, if you feel that Health Choice has not resolved your issue and or your concerns, and I will put that number and address also in the chat in the interest of time. Now, the next step would be you can file an appeal, and we have Health Choice Arizona may deny services that your medical doctor or your psychiatrist asks for, or your medical doctor, or, you know, may limit or stop your care. So, you know, you could file an appeal. If this happens, you'll get a letter from Health Choice called the Notice of Adverse Benefit Determination. And this will explain the decision that was made, why it was made, and tell you the law, actually the rule or the policy used to make the decision for you, the date the decision was made. So it explains how to ask for a second review of the decision if you don't agree with it. It also explains how to continue services during the appeal process. So not to be terminated from your services, but to continue your services during the appeal process. You will also explain what to do if you lose the appeal, and that you may have to pay for your care during the appeals process. So if you lose the appeal, you may have to pay for the services you were receiving during that process. You can file for, again, you can file an appeal by phone or in writing. And you are allowed to ask for your records. You can ask for your records anytime during the appeal, and you can also send additional info if you think that that will help your appeal process. You can also Health Choice will have someone review your file who had, if you want a second review, Health Choice will have someone review your file who was not involved in the first appeal, and someone else who's not involved in the first decision will review, and then a decision is made. So that's what I have, and I will put the information that I shared with you regarding phone numbers, addresses, and things like that to file grievance and appeal, and the member services number. And I hope that was helpful for you with respect to Health Choice Arizona and our role in complaint, grievance, and appeal. And thank you so much. I appreciate being invited to do this. This was an honor.
Thank you, Maria. Thank you very much. So the third speaker today is Katy Welty. And Katy and I have known each other for a very long time. She started her career in peer support in 2002 as a team leader in the newly formed peer-run agency NASCARE. She was hired by West Yavapai Guidance Clinic, currently Polara Health, as a peer support specialist in 2006, and is currently on their leadership team as the manager of peer support programs. In this role, Katy has created several innovative programs to introduce and include peer support in many services provided by her agency. Along the way, Katy received the NARBA Recovery Award, the NASCARE Ann Rott Memorial Award, and the West Guidance Fish Award for excellence. Thank you, Katy.
Hi, you guys. Let's see.
You got it.
Okay, I need just to go to slideshow from beginning. Yay. Okay. I'm going to talk about our mental health rights in Arizona. And you will see that it is a blessing to all of us in behavioral health to be in this state. But I'm going to start with your rights. And this is anybody who has a disability, as a person who has disability rights or civil rights. They cover any person with a disability who has a physical, mental impairment that limits one or more major life activity. Those are civil rights. So if you have a behavioral health disorder and consider yourself disabled, these are rights that you have. And especially employers must provide people with disability an equal opportunity to benefit. And this is where we get reasonable accommodation from your employer if you qualify as having a disability. So those are our federal rights. Our state rights are really amazing. Title 36, most of us know that as the involuntary option of mental health care. But Title 36 establishes a statewide plan of community residential treatment systems, which means a statewide system of community-based residential treatment programs for the seriously mentally ill that provides a wide range of services as alternatives to institutionalization, that word, and in the least restrictive setting. And I know that Susan gave you the SMI determination, but the wording is, it's defined as a mental, behavioral, or emotional disorder resulting in serious functional impairment that limits one or more major life activities. So this law is in the Arizona Revised Statutes. Then we have the Arizona Administrative Code, which comes next. And we have an entire chapter for the rights for persons with serious mental illness. Really remarkable in this state is the right to support and treatment. We have the right to have support and treatment under conditions that support our personal liberty and restrict personal liberty only as provided by law, and from a flexible service system that responds to the client's needs. I don't know if any of you have ever gone in and read Chapter 21 of Title 9 in the Arizona Administrative Code. Every single page has an enormous list of the rights that we have as a person in the serious mentally ill system. It is amazing. I absolutely cannot talk about all the rights because there are a lot. If you would like a copy of these rights, Susan, Maria, do you have a place they can get that list from?
Yes, for Health Choice Arizona on our website, which I am putting in the chat, you can go to the website and then drop down menu to member services, and then grievance and appeals. It's got a full menu there. Yes, I will put it in the chat. Thank you.
Okay, thank you so much. So that's the Arizona Administrative Code. In 1981, we had all these rights to treatment and support that were not all being met. So a man named Chick Arnold, who was a fiduciary at the time, filed a lawsuit called Arnald Lucero. And in it, it stated that we were not getting all the treatment that we are entitled to by law. The judge agreed with him and said that Maricopa County at that time violated its statutory duty. So our rights as persons in the SMI system were greatly expanded because of CHIP. Access, and here I have to, I shouldn't do this, but this is a shout out to Susan, Katy, and Chaz. We established guidelines for peer and recovery support service provision. And it defines who is a peer. It defines the certification process. And this policy turned peer support from a job into a profession. So I really want to give a shout out to the people that did this for us. If you have any questions that you think needs to be explained by a lawyer, you can always call the Arizona Center for Disability Law, and there is the phone number right there. You don't always need to call a lawyer, because one thing we have had in this state is amazing advocates in the legislature, in law offices, support groups like NAMI. Health plans have amazing advocates. So do provider agencies and peer runs. And this network of advocates is something that Arizona has that no other state does. This little flyer that I'm showing you is the result of access and health plans and a health home getting together to ensure that our clients were not paying copays for a service that is defined as free to people with the SMI determination. The amazing advocates that we have had and that we still have is one reason that anybody involved in behavioral health care, anyone with a behavioral health disorder, anyone who supports them, anyone who is an ally on their next gratitude list, the first thing should be, I live in Arizona. Thank you.
Okay. Thank you, Katy. Very
You're
nice. So basically, all three of you have raised issues of rights. And what's interesting to me is rights are mandated by the feds through access to the plans and to the providers. And what is very interesting to me is how those rights manifest themselves. So here in Northern Arizona, there's certain rights of choice. And it's in the member handbook. It's in all different levels of the REBAs and the providers. And yet what we're hearing in Northern Arizona is that many peers really don't have a choice, because there's health homes that won't refer out. So when a person asks to be referred out, that it's kept in-house. And a lot of this, it's there's a lot of financial reasons for this, but the truth of the matter is many people don't have a choice. So the three of you have focused on grievances and complaints, and quite frankly, that hasn't worked. And it hasn't worked, especially in Northern Arizona, because people are afraid. We're a small rural community and people are afraid to make complaints. And so what Access always says, well, you know, I go to Susan and I say, you know, people don't have a choice. Why aren't they being referred to the family to FIC? Or why aren't they being referred to the to NASCARE? And well, Susan said, well, you have to have data. Well, we are getting that data, and we know that that is happening. And the really sad thing is, for recovery to happen, one of the tenets of recovery is to have a choice. And yet that really, even though, and Candy can put it, the member handbook, do you want to put that up? Okay. I'll show you a copy of the member handbook that each person is supposed to get when they start to get services. And again, I'm not sure that everyone gets a member handbook, but you want to go to page 27?
Okay,
Is that the right page?
this, oh no, it's 77.
77, sorry.
Uh-huh.
So, do you have it?
It's right there.
Oh, so a member's choice. You can choose your primary physician. You have a right to a second opinion. You have the right of choice among providers within Health Choice Arizona. But it appears that these choices are only for physical health. When you're talking about our population, our SMI population, they don't have choice. Because even though it says in this document that they have a choice to go, be referred out, they're not being referred out. And we have an example of the effects of this in Northern Arizona in Lake Havasu or that area, where we had what was called Art Away meets. And this was a wonderful program where people really learned socialization skills, and there was art therapists, but it closed because the providers up there wouldn't refer it. They said, we're going to do this in-house, even though they didn't have the same service in-house. So do you have any other documents?
Yeah, actually, and I'm gonna, I do have one, and there is a question about, is there a difference under ARS rights with SMI status for children as opposed to adults? And we actually have that, if I can do that. There are 12 guiding principles of, so wait a minute, of our, I'll show you this document and then we'll go to our presenters and let them answer that question. But there is on the Access website, and I put that web link in the chat earlier so you had time to copy it. These are the 12 guiding principles of the children's system, and there's 9 guiding principles of the adult system. And Kathy mentioned you have a voice and choice, and there is a, these are called one-pagers. Sometimes they're 2 pages, but but they give you your rights, and you can actually take these into your clinics.
And I want everyone to notice it says access up at the top. This is an official document, and most of these are the result of Susan Kennard's, in her office, her work. And so these rights are very, very clear.
And Maria, you are correct. The member handbook, and actually these flyers from Access are available both in English and Spanish. And so does any of our presenters have an answer for the person who asked about the difference of children and adults' rights for SMI status?
You know
Susan?
that,
Go ahead.
yeah, so I would just say, this is not necessarily, I'm not an expert on rights, but I would say that the individuals with a serious mental illness determination do have some very specific rights. And I think Katy did a very thorough job of pointing out where you need to go to actually see those rights. Now, individuals with children, I do know that if they're connected to the DDD system, that they have some rights that might look a little bit different. For instance, when it comes to seclusion and restraint, I think that they can do difference, make some different decisions around seclusion and restraints when it comes to children in the DD system versus what it says for our SMI population. But those are the only differences I know for sure. And then I think also, Candy, you showed where there was the principles. Now, those principles for adults and for children in our system, they live in policy at Access, and so they are required to be followed. And I will just say that they are required to be followed.
Can I just piggyback off that just for 1 minute? And I want to echo what Susan has said, what Kathy has said, in that these are not suggestions. These are legal entitlements. And just know that going forth. People don't get to decide not to follow them. Okay, that's my thing.
And so we had another question to follow that one up is what qualifies a child for SMI? And George said label as SED or SEH, and I have no idea what SED or SEH means. Katy?
Yeah.
It's
So the SED is seriously emotionally disturbed, is what it stands for. But actually, children cannot receive an SMI determination. That's a determination only for adults.
Okay. All right. And
Yeah, and also if I could follow Susan on that, children age 17 can have an SMI determination done, but not younger than 17.
So I need to read the whole thing.
okay.
Okay, so we have another question. Shall not adversely affect service. Is there more to that?
No, that's how it starts.
Okay, in reality, service is very effective. A health home can decide to refuse services, but not state this to their client. I have been through this process and eventually left the second of 3 available homes due to no improvement. So that is a major concern. And I don't know who might be able to address that. I think Maria, you share that concern of choice. And I know that Veronica, your supervisor, has done some trainings of providers, and yet they still don't seem to want to refer out. It's all kept in-house. Can you comment on that?
I believe that, is Veronica on the line?
I am.
Okay, wait, Veronica, would you?
Yeah.
Thank you.
Yeah. So we have met with our executive leadership last week to finalize some concerns that we have. We requested documentation from our local peer runs and family runs, documenting the lack of referrals, including just didn't have to be completely data driven, just like written examples of things that have come up. And we are meeting with our quality management department moving forward to deal with this outside of OIFA. In the OIFA department, we have brought this to the attention of our company on multiple occasions. And as Kathy stated, I created a required referral training for our health homes to be aware of the requirements that are listed in not only in the member handbook, but in the provider manual that each contracted provider is required to follow. And it is listed in Chapter 18, Section 13, and it's regarding service planning. And in that, it states that not only does the member have choice to receive peer and or family support services from a peer and family run agency, but that the health home is required to notify the member of that choice. I do want to just let you guys know that we do take that seriously. We are following up on it. And again, executive leadership, including CEO, compliance officer, operations officer, and clinical officer, all the officers are involved. And we, again, are going to quality management. Quality management is an area of the agency. Each health plan has that. And the job of quality management is to make sure that items are being followed. As Katy said earlier, these are not negotiable. These are required items. I also just want to state, though, that if it comes to an agency that's not a peer or family run organization, that our health homes are not required to refer to them for services that they do provide in-house. And that's where it gets a little bit difficult. And so we want to make sure that our members have voice and choice. But we also need to make sure that we are, following what the provider manual says. If we're going to hold them, our health homes accountable, then we need to make sure that we are not also, I guess, putting them into situations that do not qualify under that. And that would be, perhaps maybe non-emergency hospitalizations, other inpatient facility admissions, chemical dependency, residential facilities, therapeutic foster care, things along those lines. And so we want to make sure that it's very clear for our providers, both on the health home side and on the peer and family run side. And even more important, we want to make sure that our members are aware of their rights. So again, this is listed in the member handbook, but it is also listed in the provider manuals. So our health homes and our peer and family run agencies and our community service agencies are aware of these requirements. And I'm happy to state that, it has been a long time coming, but we are making progress, and we are, again, able to involve quality management now. So, and in doing that, it's beneficial for the OIFA department because we get to put it in the hands of someone who can, I guess, for lack of better words, hold them accountable with measures and reports and deliverables that I wasn't able to do on my end. So this is a good thing, and I'm very relieved that this communication is happening on our end.
So for all you that are watching, Maria and Veronica and many of us are close friends. We talk very frequently, and they're kind of in a hot spot because we're critical of what's going on up here, but we know it's not them. And they have the courage to take it to their management and to put up with me rattling about this all the time. And so I just really want to publicly thank you both, but you're still going to be on the hot seat because we have to go through you guys, to get some change. And so when Veronica said that there's some situations that the health home may provide, like peer support, we all know that peer support is very different when it's offered within an agency because, versus a peer run. And there's documents and there's a lot of writing on that. So Veronica, what happens if a health home like Spectrum has their own peer support and a peer request to be referred to NASCAR?
So that's a really good question. So another thing, I'm going to answer that, but I also want to let you guys know that our health homes are required to employ peer supports, which is also came out of the Arnold versus Sarn settlement for regional behavioral health authorities that provide services to those with a serious mental illness. So it sometimes it can be confusing to not only members, but our providers, because peer support is required to be offered from a health home. But at the same time, member voice and choice is a requirement. So what it comes down to, Kathy, is that once a member has an intake, or even later on in their service, and it is decided that peer support is added to their treatment plan, it is then the responsibility of the health home to not only offer the peer support to that member, but also tell them, and we'll use Spectrum as an example, hi, you are going to have peer support added to your treatment plan, and you can receive that peer support here at Spectrum, or you can receive it at a peer run organization in the area, for example, NASCAR. So it is a requirement that the health home offer the choice to the member. And one of the things that we're working on to make sure that that happens, or that we were in the process of working on, was adding it to an audit tool. So at the health at the health plan level, we have to audit records, right? We have to go through and make sure people are doing what they're supposed to be doing and putting it in the member chart. So we wanted to add that component to our audit tool, but the audit tool has been put on hold throughout the whole state, the case file review tool. So now, again, we're involving quality management in a way that we can gather that information to make sure that not only are the members being offered peer and family support services, but that they're given the choice of where to receive those services if there is a peer or family run in their agency. So that's a good question, Kathy. If a member goes to Spectrum and says, I want to receive my peer support through NASCARE, then Spectrum is required to refer that member to NASCARE and submit the required paperwork to NASCARE. At the health home level, we also provide the support to the peer and family runs if they're missing any documentation on referrals, that they can reach out directly to the health home. So we can then go, to the health plan. So then we can follow up with the health home and say, hey, and we're just using this as an example, but hey, Spectrum, you need to get that paperwork over to NASCARE for the referral that you sent. So we want to make sure there's no gaps or barriers to services that the members are receiving. And as stated at the beginning, before I was able to log on, I was in another meeting today. If this is not occurring, we do need to know at the health plan. We need to know, if it comes to the OIFA office, that's great, but we do get member services involved because we want these things logged. We want to track and trend this. We want to be able to say, hey, we have a continuous problem with provider A, and we need to make sure that this does not continue. And I know that there's some fear out there, as Kathy stated, there's fear of retaliation, fear of services being discontinued, and we don't want that in any way. So if it can come to the health plan level, we can get to the bottom of that. We can make sure that there is no, discontinuation of services or retaliation. All of that can be brought to the health plan level. We will hold the providers accountable. They are not allowed to stop services.
So Lori has a question. Thank you, Veronica, for all that. My question is, when we recognize that there is this issue about lack of referrals to the Family Involvement Center and NASCARE up in the north, what is the incentive? What is the incentive to encourage the health homes to do the referral? It seems that, as earlier mentioned, the financial paying system de-incentivizes the referral. And then my next part of that question is, what is the consequence when you know the referrals are not made, when you know someone comes in and says, I asked to be referred to Family Involvement Center or NASCARE, and I was told no, because we do that here. What is the consequence for the health home? So what are the incentives to refer, and what are the consequences when they don't?
Okay, so regarding the incentives, there is no money taken away from the health homes when they refer to our peer runs and family runs. In the northern region, we have one agency that's fee for service, which is Caring Connections. But Family Involvement Center, Mentally Ill Kids in Distress, which is FIC and My Kid, NASCARE and Hope Lives, which NASCARE and Hope Lives are peer run organizations, are on a block purchase, meaning their funding between the health home and the peer and family run does not change the services to the member. So the health homes can't say, oh, well, if we refer, we're losing money. It doesn't work that way. So that's the first thing. And the second thing regarding the consequences, that's what's going to be coming from quality management. That will be in the form of a performance improvement plan and potentially sanctions. It is not in my wheelhouse or my realm of authority to put those into place because I don't work in quality management, but that's why I was super excited and hopeful now that we're able to get quality management involved, because we had enough situations and enough continuous stories and information, again, that was shared, that I was able to take it to quality management
Okay. Oh, we may have lost you, Veronica. We do have another question that came in. Rural health homes do not seem to have specialists. They also often did not have availability within 50 miles of typical service because of staffing. 100 miles away is not an option. A health home has fought that as well. Psych hospitals, supports, and therapists. Hopefully this is still not happening since we have now crossed into the adult services. This person apparently had a kiddo that recently crossed into the adult services. And so, and once again, that's choice. That's the same subject that we've been on.
So Trish, are you able to talk?
Yeah.
Trish. So Trish, just recently we did a child and family team kind of dialogue discussion, and a number of the people, I mean, we documented on the screen that people had made requests to be referred to FIC, and how FIC has changed so many lives. And yet recently I have seen the referral numbers from each specific health home over to FIC, and they're dismal. Now, can you comment on that?
Sure. I think we've had for the last several years, we've really struggled with obtaining referrals. Most of the health agencies in our areas that we serve do not have parent peer services of people employed with them on the kids side. And we really are not clear on exactly the reason. Like Veronica said, I know with Health Choice, at least we're under a block purchase. Care First allows us to do our own enrollments, but parents need to be told that there is an agency out there. And I think one of my bigger concerns is folks, they don't even know what to ask for. They don't know that there's peer support out there. They don't know there's parent peer services. So they really rely on their case managers to share all of those resources. And I don't see that happening very often. So as soon as we do get someone, if they find us, they hear about us, they do call our office, we will get health plans involved if we need to get a referral, or we will do our own referral or our own intake if possible for our services.
And thank you, Trish. I would just like to share, and some of these people are on the call, that you know, with specialty services, with DD, Asperger's, you know, some of the special needs kids, they just get lost because there aren't those specialized services. And you guys have been so wonderful all over the state in helping these families get the services. And I know some of these young people would be in prison if it hadn't been for you guys. So I want to thank you, but I fear for people that do not have access to your services and get so totally lost in the system. It's like PTSD for the family.
Absolutely. I can attest to that.
So we have another question. Are peers able to advocate for clients without repercussions from their employer? You know, maybe, is Katy back yet?
No.
Okay. So Katy's, what Katy does is, and I wish she was back on, because she doesn't really qualify as a peer run, and there's certain reasons why, but she does an excellent job in the situation that she's in, and she's kind of right in the middle of all that, and she does get a lot of referrals because she's part of the guidance center, which they have a new name now. Polara, yeah. So I wish Katy was on to address that. Are there some other questions?
If not, we can show them some resources.
Okay.
So I'm going to share my screen again. So in addition to OIFA, there is the mental health resource site, is mentalhealthresources.org. This is a NAMI Yavapai sister site, and it has, then you can see, if you click the mental health documents, this button over on the right, it has a list of mental health documents. We are continuing to add to this. In the near future, it's going to have the member handbooks for every health home. And it says who puts out this information. You can see over on the right, OIFA, and then it goes to the Office of Human Rights and the Center for Disability Law. Why I'm here, I might also point out at the top in the center, you see this button, hopefully, it says we want to hear from you. NAMI Yavapai does have, there's a form there that you can fill out if you don't want to speak up in this forum, or you don't want, you're afraid of retribution, you can put your information in here. And what we do with this is we gather this information and use this for advocacy. So if a bunch of people are talking about one thing on this form or in the comments here, you can, we will start working on advocacy in that area. In addition to that, the listings, the resources, every listing has the opportunity for you to write a review. So if you didn't want to do any of the other things, and by the way, you can do that anonymously. If you didn't want to do any of the other things, you can just put a review on the actual listing, and you can remain anonymous by using a username instead of your email. In fact, we recommend that. We showed you the Office of Individual and Family.
Could you put up the no wait list?
Oh, yes.
So I want to show you guys an excellent example of the access no wait lists. So you have a right to receive services you need delivered within the access policy. So if you go to an agency or specialist and they are unable to serve you, the agency should refer you to your access health plan to locate a provider near you. So there's, and this is for behavioral health and physical health. So you, in no circumstances should you be made to wait without giving other options. And they also have other wait lists and time periods. So I know that there's wait lists by some of the agencies, and people get very frustrated, and you can just take this in or another one pager and just show them specifically. I asked for appointment. It says right here, you have 7 days to have an appointment, give me an appointment, you know, and if not, refer me to another agency. The REBA up here and the plans have to provide sufficient treatment, sufficient availability to access to services. Susan, did you want to comment on that?
I do. I've got two things I really want to say to that. And one is, we talk about somebody saying something. So if you're trying to find a service and they're saying, sorry, we're at capacity, you could wait for 8 months to get in. If you don't say something to the health plan or to access, we don't know that there could be a network issue, because the plans have to have adequate networks, and access has to create that oversight to make sure they have an adequate network. But if we don't hear from somebody that they're having trouble getting, like when you mentioned particular specialties, that's how the health plan will know, and we could have that conversation with them at that point, that there seems to be a network sufficiency issue around this particular specialty in this area, and they may need to contract with somebody else. So please, I know it's hard for people to say things and they worry about the retribution, but even if you just want to reach out to NAMI and just let them know, hey, anonymously, hey, we're trying to get a hold of a certain service and we're just not able to get connected, and we're being told that there's no providers in our area, just so that you can raise that flag, that would be really important.
And Susan, one of the biggest areas up here is substance abuse treatment and the availability. And in a couple of months, we're going to have First Mental Health Monday discuss substance abuse and the availability of treatment. And so this kind of, leads into that, because there are major challenges for that up here.
And Susan, maybe you have that answer. Katy is trying to get back in right now, but do you have an answer of what peers most often what right they don't know they have?
It's really around the choice. I mean, that's what I hear at an access perspective, that people don't realize that they have the opportunity to choose the provider where they would like to get services. And so, that's really important. And there are some services that, like I mentioned earlier, you could get part of a service over here at this provider, but then maybe there's a group or something going on over at this provider, but you could request to go to both places and get some of those services. As long as somebody says that that's medically necessary, you could do that, because you can't, you wouldn't have to just go to one place and get all your services there. So that choice is really important.
So Susan, are you aware that peers from all over the state have a choice of their medical, their physical and behavioral health providers? With the exception of up in Northern Arizona, our peers have a choice of their medical provider, but they don't have that choice for their behavioral health. That piece is not working. So this is really kind of a form of discrimination. And it's a small group of people all over the state that, have availability except for up here.
Kathy, I would like to step in here and say they do have the choice. Unfortunately, as we are hearing, it is not working. The health plan and the REBA have been made aware of that, and we need to be given a chance to follow up on that. I 100% will tell you they do have the right. It is written in the member handbook. It is written in the provider manual, and the health plan knows that and is following up to make sure that the health homes are held accountable. Members can go directly to a peer or family run agency in the North and start services with that provider. That's also written in the provider manual. The peer and family run agencies have also been notified, and then they reach out to the health homes for the required paperwork. That's where, if the health homes are not collaborating and getting that paperwork to the peer and family run, that the health plan needs to be notified. We will come down on them, but if we're not notified, we don't know what's not happening. And it is frustrating. I can sense the frustration, but I hope that you hear my frustration, because I don't want this to be happening for our members. I really, really don't. But unless I'm included in what's not working, it's very hard for me to fix it. So I do know what's not working right now. And it has been taken to leadership. It is being followed up on, but peers and members and family members do have choice in the North. They can go directly to a peer or family run organization and start services. They do have to be a part of the health home model, but that will not stop them receiving services at a peer or family run organization. They do not have to start at the health home and wait for the health home to refer them. They can go directly to a peer run or family run, and the process just kind of works backwards.
Well, thank you for the clarification, Veronica. From what I'm understanding up until this point, because I'm hoping you're going to change it, but when they go to, let's say, FIC, and they ask for that, after that 10 days, they ask for the referral from the health home, they disappear from FIC. They don't come back. So that's something that we need to work on. And, but I really do appreciate, I know what you're going through. So Katy, we're very glad that you reappeared, And we had a question for you.
And it was my question.
Okay, go ahead.
Sorry, you guys, I got kicked out and then I couldn't get back in. So here I am.
Sorry, and I'm going to connect with you and try to figure out what the issue was about getting back in, except that I was doing 3 things at once, but beyond that. But I was wondering, because you work with peers, what are you most surprised, what rights are you most surprised that they don't know? That's
Right to support and treatment. There are so many peers out there that are paying co-pays for meds, co-pays for providers. And they just go ahead and pay it because it's less hassle. And people really need to not do that. People need to call you guys, call Access or call Health Choice. People just accepting other people denying their rights, we can't do anything when they do that. Like Veronica was saying about let us know. And that's why I said these rights are not suggestions. They're legal entitlements. And I think everybody needs to know that.
So Katy was instrumental. If you guys aren't aware of it, one of the drugstores was charging quite large copays, up to $100 and more, for our peers for years. And Katy did, Katy went in there like a sleuth and investigated and brought it to the state and took it to Susan. And the drugstore, even though they made millions of dollars off of all this, is no longer exploiting our, and this was all done up here, so, or across the state. So thank you.
It was
Kate.
across the state.
Thank you, Kate. We put a stop to that. So are there any questions, any more questions or comments? I see that Tammy with Spectrum is on. Tammy and I were just in a meeting together. So how are you doing, Tammy?
I'm good. Good to see you. And Katy, Welty, it is an honor to see you and have you present again. I always enjoy it.
Oh, yay. It's good to see your face.
So
Hey,
Tammy,
can I ask real quick on the, so I'm sorry I had to step out for a minute, so you may have answered it while I was out, but when we were discussing about the, that a health home has to provide a service in a certain time frame or refer them to someone else. I know that specifically Spectrum is not currently the only health home or anywhere for that matter that is experiencing a huge staffing shortage. So when someone does right, so when someone does come in and they're seeking a service, and we'll use psychiatry as an example. So someone comes in and they do their intake and they're wanting psych services, and so when you're short staffed, of course all of your psychiatrist schedules are booked out for 4 to 6 weeks. And so then we make these calls to the other health homes. What's your availability like? And you come across other ones that are the same as you, or maybe even 6 to 8 weeks out. How can we, as a health home, provide them that timely service when we just don't have the ability right now?
Well, let me just say one thing that came up at our partner advisory council meeting, and that was short staff is not a reason to deny rights. So what I am going to say to you, which is really rude, is but if you have to contract out, these are legal rights. So contracting out to local providers, can you do that? I don't know that much about that side of things.
So Katy, in response to that, and it was not rude at all, I totally understand what you're saying. So like I can tell you like something that I experienced a couple of weeks ago is actually opening up the Google and finding private psychiatrists
There you
in the
go.
in the Prescott area, and every one of them that I called said that they are 3 months out on availability.
So this is a situation for access. Because you are responsible, Susan.
Yeah, absolutely, Kathy. And so when I was listening to this, Tammy, I was thinking two things. Number one, you're contracted with a health plan. If you're having trouble meeting those timelines, you've got to let your contractor know and let them see if they can't troubleshoot this with us. And you're also welcome to always go to Access too, because we know nationwide there is huge staff shortages, not just in healthcare, in all areas. And so if where those things are happening, please let people know, let the health plan know, let Access know, so we can be working on this.
But you know, Tammy, I think it's very important that you brought this up because, you know, we get very frustrated. We can't get appointments. There needs to be a little bit of understanding. And also, I'm hoping you guys are triaging or making sure that the most vulnerable do get their appointments, because we're getting feedback about people not getting their medication,
Right.
ending up in the hospital. So we just, you know, I know you guys are taking care of that. We need to all be supportive of each other in this challenging time. Okay, so we're gonna have to wrap this up.
Okay, and we want to thank everybody for coming, but we want to be mindful of your time. And so we don't want to go over.